the submandibular region. This is the submandibular salivary gland occupying the digastric triangle and extending from the angle of the mandible to the level of the mental foramen. The facial artery is seen attached to its posterior end and continues between it and the lower border of the mandible. The artery then crosses the mandible at the anterior-inferior angle of the masseter muscle to enter the face. The submental artery arises from the facial artery just below the mandible and runs forwards towards the chin. This is the facial vein crossing the surface of the submandibular gland. This part of the gland is its superficial part. It has a deep part which is smaller and lies deep to the mylohyoid muscle. This part will be seen on the opposite side of the specimen. This is the superficial part of the submandibular salivary gland showing the facial vein on its surface. The submandibular lymph node is also seen on its surface. This is the mylohyoid muscle. It's deep to the submandibular gland. This is the anterior belly of the digastric, superficial to the mylohyoid muscle. The mylohyoid muscle forms with the hyoglossus muscle the floor of the digastric triangle. The mylohyoid muscle is triangular in shape, having a horizontal upper border by which it arises from the mylohyoid line of the mandible. It has a free oblique posterior border around which the submandibular gland curves to form its deep part deep to the mylohyoid. The medial border of the muscle is attached to a median raphe which extends from the symphysis mentae down to the body of the hyoid bone. It's supplied by the mylohyoid nerve and forms the floor of the mouth, and so called the diaphragma oris. The flexion of the mylohyoid muscle exposes many important structures. This is the geniohyoid muscle, extending parallel to the middle line from the inferior genial tubercle down to the body of the hyoid bone. It's supplied by the serous cervical through the hypoglossal nerve. Reflection of the geniohyoid exposes the genioglossus muscle, which extends backwards from the superior genial tubercle to the front of the root of the tongue. It's an important muscle as it protrudes the tongue and prevents its base from falling backwards and obstructing the airway. This is the hyoglossus muscle. It extends upwards from the brachial horn of the hyoid bone to the side of the root of the tongue. Its superficial surface is related to the lingual nerve running on its upper part and to the hypoglossal nerve on its lower part, while the deep part of the submandibular gland and its duct lie in between the two nerves. Notice the submandibular ganglion suspended from the lingual nerve. It's very small and shows postganglionic fibers passing to the submandibular gland. Notice also that the lingual nerve curves round the submandibular duct, where it comes lateral and below and then medial to the duct. Both structures then proceed forwards between the genioglossus muscle and the sublingual gland to reach the floor of the mouth. Border of the